Let's learn how to draw some blood. The supplies we have for that are a butterfly needle, a vacutainer, a tourniquet of course, and then you can use a blood transfer device, but I don't have one, so we're going to be using a syringe and a needle to transfer our blood into our vacutainer. This end of our butterfly needle is where you would connect a blood transfer device, but since we don't have one, we are going to take that off and connect our syringe. Now we're going to want to find a good vein. Once we have found that vein, we are going to wipe that off well with some alcohol and then allow it to dry. With our elderly patients or patients who might just have some looser skin, we're going to want to hold that vein very taut so it doesn't move around on us. You can see how these flaps are turned slightly upwards. That is how we are going to hold our needle, just like that. When we insert the needle into the vein, you will see a little bit of flashback in this chamber here. It will be very subtle. We're going to want to pay very close attention to that so we don't go through the vein. I like to place my syringe near my left hand so it's ready to be pulled when I'm in the vein. When inserting the needle, you're going to want to go in at a 15 to 30 degree angle. And when we see that tiny bit of flashback, we're going to immediately stop and pull back on our syringe. If we're in the vein, we will see a nice flow of blood through this tube. If we're not, we're going to have to readjust. And here is what it will look like as the blood flows through the tube and into the syringe. Once the syringe is full, we will disconnect it from the butterfly needle and connect it to a transfer needle. We will insert that needle into our vacutainer, and it'll kind of just suction it up on its own. Once the blood is transferred, we will wiggle it back and forth a couple times, put a patient label on it, sign, date, send it down to the lab, and you're finished.